Welcome to the Voice for Choice with Diane Hall, Directed Dining Approaches. In this series, members of the BSN team will be interviewing Diane, a former administrator, longtime advocate for person-directed dining practices, and the author of The Inside Scoop on Informed Choice training manual. Interviewing Diane will be Gail Douglas, BSN Regional Director and contributor to the manual. They'll be talking about Diane's unique perspective on the requirements in the new final rule from the Centers for Medicare and Medicaid Services and how those requirements will affect the five-star quality rating system with regard to person-centered care. Let's go to Gail.
Thank you, and hello to everyone. It's our pleasure to talk with you today, and I'd like to start off with asking Diane a first question. Diane, I'm just wondering what you think was behind the changes in the CMS requirements that now place the focus on resident rights, specifically the right to make an informed choice.
Well, if you want me to be honest with you, Gail, I think one of the main reasons that culture change is finally coming into long-term care is the wave of the baby boomers that are going to be using the services for skilled nursing homes and assisted living for the next 15, 20 or so years. I mean, these folks are savvier about their rights and expect their rights to be honored much more than our parents ever did. I mean, the silent and the GI generation, once that's over, I think you're going to see a lot of changes in philosophies. This age group, the baby boomers, is represented by being both consumers and customers of long-term care services. They're members of organizations across the country like Pioneer Network, the Eden Alternative, Action Pact, that are all dedicated to making these fundamental changes to the values and practices in nursing homes. So, I don't know. I mean, the more I think about it, I'd like to say something, I guess, before we move on to the next question also, in that I want to mention there's a large coalition out there of professional associations like the American Medical Directors Association, the Academy of Nutrition and Dietetics, and many others that have written standards that are supporting the individualized and care and the informed choice. So it's good to see that their efforts are bearing fruit to the support of these changes. And then we're seeing and talking today about the way the federal requirements are actually supporting the changes.
Well, Diane, I'm a baby boomer myself, so this conversation is definitely relevant to me and to my friends. What do you think is going to be important to my generation as consumers?
Well, of course, choosing where they want to live, making sure it's more like home, more than an institution. I mean, what would you and I want? They want to be in charge of their lives. They want to be respected. They want to live in a dignified manner. I mean, and all of that means eating and drinking what you want, where you want, when and even if you want. So, in other words, if I wanted to miss breakfast altogether and sleep in, they know at this point it's their right to do so, and they're going to be demanding the communities to arrange whatever they have to make it happen.
Yeah, I see, but when you say eating what they want, do you mean then that people who have a restricted diet order prescribed by a doctor can eat anything?
That is a good question, and it's one that I'm asked a lot, and I'm prepared to answer you, Gail. I'm going to tell you that CMS recognizes that the responsibility to respect the resident rights for self-determination, that is equal to their responsibility for the resident safety and concerns. So I would say that the answer lies in the CMS requirements and support that, yes, people can eat anything they want as long as they want, as long as they made, an informed decision. There has been a huge emphasis on informed choice across the board, not only just in the requirements, but it's now very clear that risk and benefits of any restricted diet must be explained to the person prior to ever beginning such a diet plan. So, I mean, this whole issue is not necessarily easy, and it's one of the main reasons why our company created a manual that focuses on the issue of informed choice and individualized diets. It took us, I'm going to say, near 2 years working on the content, especially the tools, the documentation tools that would make it easier for care providers to safely discuss and document the approaches to truly person-centered care.
Right, and in that time frame, we knew the new final rule from CMS was going to be coming out, and now it's here with us. Diane, what do you see are the biggest changes in the new CMS requirements?
Well, I don't know if you get many folks to say this, but I think the biggest underlying change is the language in many of the requirements. And to help sort this all out, we've created what's changed, which is a guide to the new, of course, final rule requirements as they relate to nutrition and dining services, since that's our business. And we've highlighted those changes. They're in a red text and in italics. And I think once our audience there, once they see this, it's a real eye-opener to see how much red is on each page. But certain words have been replaced for a slightly different meaning, a more centered approach, which is very interesting.
Yes, and I'm one of those strange people who've actually read the entire final rule, and I have to tell you, it is fascinating reading. But to boil it down to an example, could you give us an example where that wording change is truly significant as it applies to person-centered dining?
Sure. What about the requirement that reads, and I'm quoting this, but it reads, the facility must provide each resident with a nourishing, palatable, well-balanced diet that meets nutritional and special dietary needs, period. Okay? Now let's look at the way it's changed, and you'll see the words that are in italics in the handout there. It says the facility must provide each resident with a nourishing, palatable, well-balanced diet, but wait for it. It says that meets his or her daily nutritional needs, and then taking into consideration their preferences. So notice how they added his or her to the daily nutritional needs. Okay, it's pointing out that we're talking about individuals, not some generic group of people who all have the same daily nutritional needs. And then to further drive home the point, it's focusing on adding that second part to the sentence, which actually says to the requirement, quote, taking into consideration the preferences of each resident. Clearly, this is demonstrating an emphasis on the resident rights to choose and individuality. In other words, not one size fits all here when we're talking about diets.
Well, exactly. And as you know, I work in a variety of long-term care communities, and some are much further along with resident choice than others. How do you see these changes affecting those communities who don't have resident-centered dining practices in place?
Let me put my administrator's hat on here for a minute and look at it from a business standpoint. I hate to tell you, but failing to meet these requirements, it's going to directly affect your 5-star quality rating there. I mean, and believe me, people these days, especially the baby boomers that we just talked about, they're using the 5-star rating system to go online and make their decisions on either where they want to live or where they're moving maybe a loved one. They're using it. So these ratings are huge, and actually more and more even insurers and other payers, as well as provider networks, to select communities to build relationships on, are paying attention to these ratings. And I hate to tell you, but I think the poorly rated ones that are maybe just 1 star, they might not be able to obtain sufficient referrals and receive Medicare and Medicaid funding. So, I mean, they might be even looking at going out of business, Gail.
Wow, that's huge, and certainly quality is key, and that's the services we want to provide to our residents that we care for. So to summarize, Diane, tell me if I'm kind of right on this. It seems like person-directed dining practices and the CMS final rule requirements and also the 5-star quality rating system are all working together to create that welcoming environment that truly focuses on the individual and their preferences for each person. Is that right?
Oh, my word, absolutely.
Yeah.
I mean, I believe that if you have procedures in place to create these person-centered dining plans, and you have the documentation tools that are proving and recording the discussions of risk, benefit, and the approaches to the residents' dietary choices, then hands down you're going to meet the CMS requirements, and then obviously increase your 5-star rating. It's a given.
And I agree with all that you just said, Diane, but here's my question. If a community has not yet begun this process, what do you think is the first step that they would need to take to really begin to work towards meeting these new requirements?
Well, you need to probably have a due diligence there on evaluating where you are regarding mandates for more person-centered approach. I mean, I know our customers have found it very useful and helpful, and we provide detailed assessments and audits of their dining practices. We process the information, we give them a report card, we target areas that, are either they're doing right or need improvement, and then they're either on their own to develop an action plan to improve those areas, or we already have some needed tools and resources developed. They can seek our services to help make a more person-directed dining happen in their community.
Yeah, and that makes sense. And as you know, Diane, as a BSN team member, I've been involved with helping some communities with their journey with person-centered and person-directed dining. And for our clients who want quick action, we can roll out our program on informed choice that we base on our training manual, which is called the Inside Scoop on Informed Choice. And with this, we can get staff up to speed on making person-directed dining happen in the community and giving residents what they want to eat and as safely as possible. And as well, we want to help the community avoid any future citations or legal issues. So the training we provide includes videos, helpful references, and those ready-made documents that really helps the staff get going right away, moving towards the informed choice that they want to provide.
Yeah, I mean, you're right. We do all that, and we start with handouts, don't we? I guess the most important thing to portray to everyone is the entire community has to be informed about these changes to person-directed dining, don't they? I mean, they have to know what to expect. They have to know what to expect with a more liberalized, individualized approach to meals. And this, it doesn't just include staff. I mean, you have to include residents and family. And let me tell you, we start with a letter from the medical director. I mean, we get the medical director on board immediately, and then have the medical director send a letter out that's informing physicians about the center's true commitment for supporting the new dining standards and some liberalization and individualizing. So we do have a step-by-step procedure to help create the care plans, and we use a documentation tool, Gail, that I know you're familiar with, and the Informed Choice Made Easy, that seems to have really helped the most.
I think it does. I think that the care planning process is a big issue at some communities, and they're not sure how to proceed. Could you tell us just briefly how this form works, Diane? Yeah,
the form takes the resident and the care team there through the steps of making an informed choice. There's questions on the form that ask if the current diet restrictions are important. Are they an important part of the care plan rather to the person, or do maybe they want to explore a more individualized, liberalized approach? That's why the tool includes the current research on residents. Listen to me. The tool includes current research on risks and benefits. And we happen to choose the 6 most commonly used diets in long-term care, right?
And I found these forms really have been easy to use. I think everyone's found them to be very helpful and leads the conversation and really helps the team work together with the resident to identify what their choices are. So they're really good to use.
Okay, and remember, the next step of this, with any informed choice, is the importance of documenting the conversation between what happened with the resident and the staff about the risk, benefits, and alternatives. So recording what matters most to the resident becomes paramount when we're creating a care plan, especially when a resident is making a risky decision. So you can either create your own forms and document the conversations, or obtain documents that have already been developed and tested for effectiveness. And that's what I think we're mentioning here, that's what we have here and available.
Yes, I know we have a lot of forms and handouts, and some of those assessment tools are available on the BSN website.
Yeah, I mean, there's a bunch of free documents that help ease the transition for folks to a much more person-directed approach to dining. And I hope people will visit our websites. I think it'll help them.
Oh, that's great. Thank you, Diane. It's really been an interesting conversation. I hope our listeners have enjoyed it. And I would like to continue this discussion next, focusing on the details of the 5-star rating program and how it can be affected by dining and nutrition services when we next get together.
Sure, there's lots to talk about with a 5-star rating and how it relates to nutrition and dining services. So it'll be my pleasure. See you next time.
Great. Okay. Bye now.